I have kept few interventions. These interventions have a strong evidence in neurorehabilitation, which has proven that neuroplasticity is working. And based on that principle of neuroplasticity, the interventions are designed and they are very well currently practiced, and patients are showing very good recovery. So one of them is constraint induced movement therapy. We call it as CIMT. All right. So in this, I just kept a photograph for you to understand. In this, if the patient is having, left side normal and right side is affected, so constraint induced movement therapy is trying to restrict the normal body part. So as you can see in the picture, the patient's left hand, which is normal, it is tied with a black bandage or maybe a strap, and the patient's that part is restricted. So that is known as constraint. The patient's right side is weak, but what we are doing is we are forcing in the left side of the motor cortex. So we are trying to fire up the left side of the motor cortex that, come on, you can do it. All right. So we have constrained the normal side. We are encouraging only the weaker side. Come on, work it out. Repeat it. Try to do it. And we are trying to fire up that damaged part, that part which has lost the functions. But we know one day that is going to spark up. So we keep trying. And this concept of constraint induced movement therapy, it forces the patients to use the weaker side only. At times it is frustrating, but yeah, we can always modify our duration of treatment. All right, and excellent evidence is there, especially in the upper limb recovery. Yes, so CIMT is a very good, approach which is currently used in the neurorehabilitation, where patient use the weaker part. The patient is made to use the weaker part. Otherwise, if you don't keep any constraint, no restriction, patient will definitely use the normal part, and the weaker part will become more weaker. So this CIMT is opposing that, and it is encouraging the patient to use the weaker part and make it more and more stronger, and ultimately making the neuronal networks more stronger in the brain. All right, so I think the concept of CIMT is clear. Even talking about the task-oriented training or task-specific training. So as I said, this approach is very important. You need to give specific tasks to the patient. Don't just give any random task that lift the dumbbell or you take the TheraBand, you hold the bottle. You have to give them a task. You can give them a bunch of newspaper and you have to tell them, flip the newspaper and stack it up this side. You will flip the paper, they will stack up this side. So it is a specific training. So brain develops that pattern, turning the pages, folding it and stacking it up. So the brain learns that precision of movement, which is actually required to survive in life, not just any FSR movement. Okay, so always give task specific training to the patient. Try to engage the patient in some specific pattern of movement. You have to design the interventions based on the patient's condition. And mind well, when you do this, you encourage the reorganization of motor maps in the brain. The neuronal networks will get activated and it will lead to the good functional recovery. All right, and of course, there is evidence. There are a lot of systematic review, meta-analysis is done, which has shown the effectiveness for functional recovery. Even the mirror therapy is one of the treatment protocol which is practiced in neurorehabilitation. All right, so I just kept a photograph for you to understand. If you can see, there is a mirror box in which the patient's affected limb is actually kept inside the box, but patient's normal hand is outside the box. So when the patient is doing the movement on the normal side, if the patient is holding the ball and trying to squeeze it or trying to move it, the patient will be actually seeing the movement of the normal hand. But the brain is getting cheated over here. We are trying to create a visual illusion in which the patient is seeing the movement of the normal hand, but the brain feels that it is the left hand because the mirror shows the double image. So if I'm moving here in the mirror also it will show this, but it is actually the reflection of this. But brain feels that my left hand is moving. So it's going to fire up the abnormal side. It is going to shoot up the movement of the weaker side. Sorry, not the abnormal side, the weaker side. So the hand which is inside actually, which is hiding in the box, will show some flicker of movements. Okay, so that is the visual illusion which is created. And this therapy again, upper limb rehabilitation mirror therapy is very well useful. And even the conditions like phantom limb pain and hemiparetic patients, they have shown wonderful results using mirror therapy. So again, this is working on the basis of the neuroplasticity. So that is one of the therapy I would like to share. Even the functional electrical stimulation. I hope everybody knows functional electrical stimulation. It is a electrical stimulation technique where the electrodes are kept on the limb, made the upper limb or a lower limb, on the motor points, but during the functional task. All right. So when the patient is doing the movement, at that time the electrical stimulation is given, so that whenever the movement is not possible, where the limb is naturally not able to do it, the electrical stimulation will achieve the muscle contraction. So even FES works on the principle of neuroplasticity. And of course, in gait rehabilitation, it is very widely used, functional electrical stimulation. All right, increase in muscle strength and motor control in various conditions, especially hemiparetic, stroke patients, even the spinal cord injury patients. Functional electrical stimulation is widely used. All right, and yeah, if I talk about the recent advances, the robotics and virtual reality are growing like anything. Why? Because slowly and eventually the research has proved that these techniques, virtual reality, how the virtual reality works. It's not the actual reality, but it's virtually created. The patient is made to wear the devices in which the patient feels that he is standing in between the mountains or he is walking in the garden, and patient feels to move. So the environment, the brain is again given the illusion that he has to walk. So that illusion will spark up the brain and the patient will try to initiate the movement. So that's virtual reality training. Even the robotics, which are combined with virtual reality, it helps to achieve the movement. So the robotics, the artificial machines, they are made to attach with the patient's body part and they are made to walk. All right. So even a flicker of movement or a flicker of initiation from the patient's side will be detected, and the robotic limb will initiate the rest of the movement. All right. And even it's not only about walking in the garden, but there are different tasks. If the patient is made to stand in front of a big screen and there are sensors kept on the hand, sensors kept on the foot. So when the patient is moving the hand in the screen, the animation will also move. So it will be like a game. So if I move my hand like this, in the animation in the screen, the animation will move. So that will encourage the patient to do more and more. So it will be like a game, like hitting the balls, trying to catch the ball in the animation. So the sensors will work in synchrony with the animations which is created in the software. All right. So these all are ultimately forcing the brain to fire up more and more, encouraging movement, facilitating the movement, and firing up the brain. Ultimately, the magic working behind all this is the neuroplasticity. Ultimately, movements are being increased, the repetitions are being done, but in different forms of exercises and different forms of supportive devices. And again, rewiring the brain. All right. So that are all the various evidences of different tasks. Now, as I said earlier, it's not only the theory, these things are actually working. So how to measure neuroplasticity and how to monitor it? There are advanced technologies where there is something known as functional MRI. All right. There is something known as PET scans. All right. Which shows the functional changes. All right. So the X-rays and MRI, sorry, not X-ray. MRIs have been taken. All right. So functional MRI shows the live changes happening in the brain. All right. So whenever the patients pre and post MRIs are taken, it shows the firing of the areas which were not initially working, but now they are firing up. All right. And the area where the blood supply, the angiogenesis is happen, that area shows the increase in the density. All right. So the MRI will literally show the reduction in the size of that ischemic area, which was seen earlier after stroke. But after a few months of exercises and after a few years of neuro rehabilitation, that size of the ischemic part is reduced and the activation of that part has increased. All right. And of course, the best way to monitor neuroplasticity is quality of movement. We are able to see the movement pattern is increased. We are able to see the quality of movement. We are able to see the patient's walking capacity is increased. We are able to see the patient is using the upper limb. That itself is the biggest measuring instrument, the outcome measure, the quality of movement, which by observation also you can see that neuroplasticity is there. All right. So that's about the measuring and monitoring. So yes, so to summarize my session today, I would say it's a boon to physiotherapists because we are the persons, those who are actually taking care once the patient is getting discharged, when the patient is having after surgery, we are taking care of the patient. We are making them back to normal. We physiotherapists work very hard to regain the movement, but neuroplasticity, it is a boon to us. Due to neuroplasticity only, we are able to achieve the movement. Since the brain has a natural ability to reform itself, to mold itself and modify the neuronal networks. All right, so we are able to achieve the motor function, which is mediated by the neuroplasticity. So currently, even the ongoing research, they are trying to focus on more and more development of rehabilitation strategies that facilitate neuroplasticity, which will maximize the functional outcome. So like I discussed, CIMT, mirror therapy, task-specific training, and even functional electrical stimulation. Even still research is going on to develop more and more such approaches and ultimately using the principles of neuroplasticity and ultimately to achieve the normal life for the patient. All right, so that's what it's all about. Yes, thank you and Jai Hind. Here is my email ID. As you can see on the screen, you please feel free to contact me on my email ID and you can give me the queries. I'll be happy to share my knowledge and expertise. Yes, that's all from my side. Thank you. Yes, ma'am.
Thank you. Thank you so much for the enlightening session, sir, that you gave to our viewers. And I hope everybody will have an insight about what neuroplasty actually is. But there are certain questions in my mind that I just need to ask you.
Yes.
I just want to ask that what are some key signs that that we can just see in the changes, neuroplastic changes in the patients. So how can
Yes.
we are ruling out that the patient is showing such a signs?
Yeah, ma'am. First thing I would say the quality of movement, as I always say. Uh, we, as a physio, we actually don't have such tools at our clinic where we can measure actually. But movements will be a very good reflection of the improvement. So when the brain is achieving neuroplasticity, you can see the improvement in the movement of the patient and the quality of life. So basically, we use the outcome measures of the patient's improvement in the activities of daily living or the quality of movement.
And
Yes.
can you just specify that how the environmental factors influence the neuroplasticity? Like neuroplastic recovery में environmental factors का कुछ role होता है क्या?
Environmental factors.
Yes,
Yeah,
like
yeah.
climatic change, like yeah.
Yeah, environmental factors. Yeah, I would say they affect, but they don't strongly influence the neuroplasticity. But yes, I can say that it's difficult for the patients to cope up during summers. We cannot more and more push the patients to do more vigorous exercise or repetitions. But yeah, it's quite easier for patients to perform during summers or cool atmosphere. But as such, outcome measures it won't much vary. It will go just slightly. It is going to affect, not much. Yes.
Okay, so one more last question I will just ask you.
Yes, ma'am.
Like you have mentioned about technology. You discussed about the virtual reality, you discussed about robotics and the FES. So can you
Yeah.
just elaborate this thing that how they can enhance the neuroplasticity in our neuro patients?
Yeah, actually, first of all, I would say that technology and all is a boon to us. See, when I talk about a neurologically affected patient, it's a
Yes.
lot of physical stress for the therapist. So when it comes to technology, this robotics help us a lot to reduce our physical stress. They help us a lot to reduce our physical load. A lot more of weight bearing and supporting the patient. Holding the patient is done by the harness or maybe by a robotic device. So we can focus on the other things which are actually mattering rather than giving our more energy in just stabilizing the patients. So this technology and all, they are very helpful for us to they act as a very strong facilitators for neuroplasticity.
Yes, because
Yes,
like right now there is a era of artificial intelligence. So we just currently do the research work, and there are so many researches ongoing related to what
exactly.
technology is having some benefit on the neuroplasticity or the neuro rehabilitation.
Yes, of
So
course.
it was a very, I will just, at last, I will give you a thank you note. It was totally a very enlightening session. Your
Thank you.
insights and engaging presentations were truly valuable. So
Thank you.
looking forward to much more the enlightening sessions and learning opportunities with you. Will meet you in future again. Thank you. Thank you so much,
Sure,
sir. Thank you for your
sure, ma'am.
time.
Thank you so much, ma'am. Thank you again, Sanchiti Institute of Physiotherapy, for giving me opportunity. Yes, thanks a lot. Yes, have a nice
Thank you,
day.
sir.
Thank you. Yeah.
Thank you, sir.